Contraception, Chapter 1, by Danielle, Madison, Denzel, Hannah, April, Jennifer, Salma, and Mary Jean. The history of contraception starts way back in ancient times before the 1800s. Contraception is combined of strategies or devices that reduce the risk of fertilization or implantation of an egg in an attempt to prevent pregnancy. A human ovum can be fertilized no later than 12 to 24 hours after ovulation. The ability of sperm to fertilize ovum lasts no longer than 24 to 48 hours. Postpartum discharge instructions should include discussion of future contraceptive plans. Methods of contraception include natural family planning, barrier or hormonal, intrauterine methods, and surgical procedures. Family planning. Abstinence, or no intercourse, eliminates sperm from entering the vagina. Advantages include that it's most effective and eliminates the risk of sexually transmitted infections if no genitalia contact. Disadvantages include that it requires self-control, with no risks. Coitus interruptus means withdrawal of the penis from the vagina prior to ejaculation. It is important to provide education such as how fluids may leak from the penis. Advantages include possible contraceptive if no other forms are available. Disadvantages include it being one of the least effective methods and no protection against STIs. Calendar rhythm method. Avoiding intercourse during ovulation, which occurs about 14 days before the onset of the next menstrual cycle. Also timing intercourse, keeping in mind that the sperm is viable for 48 to 72 hours and the ovum is viable for 24 hours. It is important to educate the client to record the number of days in each cycle from the first day of menses for a period of at least 6 cycles. Calculating the fertile period by subtracting 18 days from the number of days in the shortest cycle, and calculating the end of the fertile period by subtracting 11 days from the number of days in the longest cycle. Risks include various factors that can affect and change the time of ovulation and cause unpredictable menstrual cycles and the risk of pregnancy. Disadvantages include that it is not reliable, does not protect from STIs, requires accurate record keeping, and requires abstinence during fertile period. Advantages include that it is most useful when combined with basal body temperature or cervical mucus method and is inexpensive. Standard days method, or known as cycle beads, is a more modern form of this calendar method, with the use of a standard number of fertile days for each cycle with the use of color-coded beads on a string necklace. It is important to educate the client that it starts on the first day of each menstrual cycle, and the rubber ring is used to advance 1 bead per day. The red bead equals first bead and first day of the menstrual cycle, brown bead equals non-fertile days, and white bead equals fertile days. Advantages include an increased adherence by using a visual aid, a mobile app available, and it is easy to understand. Disadvantages include that it is unreliable for menstrual cycles longer than 32 days or shorter than 26 days, and you can lose track of the days. Basal body temperature is when a female uses her basal body temperature to predict ovulation. It is the measure of oral temperature of a healthy person upon waking up each morning to monitor ovulation. The temperature rises on the day of ovulation and remains at that level until your next period. Basal body temperature should not be used if the female is ill, very tired, stressed, alcoholic, or has interrupted sleep. It causes inaccurate interpretation of temperature changes. A slight rise shows that the body is ovulating. Cervical mucus method is a fertility awareness method based on ovulation. It is a symptom-based method, with the symptom being cervical mucus. Ovulation occurs approximately 14 days prior to the next menstrual cycle, which is when a woman is fertile. Following ovulation, the cervical mucus becomes thin and flexible under the influence of estrogen and progesterone to allow for sperm viability and motility. The ability for the mucus to stretch between the fingers is greatest during ovulation, also known as Finn-Barrett's sign. It is important to educate the client in engaging in good hand hygiene prior to and following the assessment, begin examining mucus from the last day of menstrual cycle, allowing mucus to be obtained from the vaginal introitus and that it is not necessary to reach into the cervix. Cervical mucus method continued. Advantages include that the woman can become knowledgeable in recognizing her own mucus characteristics at ovulation, and self-evaluation can be very accurate. Self-evaluation can be diagnostically helpful in determining the start of ovulation while breastfeeding, noting the commencement of menopause, and planning a desired pregnancy. The disadvantages include that some women are uncomfortable touching their genitals and mucus, and it does not protect against STIs. 2-day method is a symptom-based method that involves checking for vaginal secretions daily with no analysis of secretions. After 2 days without the presence of secretions, the fertile period has passed. It is important to educate the client that if vaginal secretions are present 2 days in a row, avoid unprotected intercourse to prevent pregnancy. The advantages include that it is simple and easy to use. Disadvantages include that it requires daily assessment for vaginal secretions. Barrier method. A male condom is a thin rubber sheath a man wears on his penis during sexual intercourse as a contraceptive or as protection against infection. Male condom may be made of latex, rubber, polyethylene, or natural membrane. It is important to educate the client to place a condom on the erect penis, leaving an empty space at the top of the penis for a sperm reservoir. Following ejaculation, withdraw the penis from the vagina while holding the rim of the condom to prevent any semen spillage to the vulva or vagina area. It can be used in conjunction with spermicidal gel or cream to increase effectiveness. The advantages include that it protects against STIs and involves the male in the birth control method. There is no adverse effects and it is readily accessible. The disadvantages include a high rate of noncompliance, can reduce spontaneity of intercourse, the penis must be erect to apply condom, and withdrawing the penis while still erect can interfere with sexual intercourse. A female condom is a vaginal sheath made of nitrile, a non-latex synthetic rubber with flexible rings on both ends. It is important to educate the client that the closed end of the pouch is inserted into the vagina by the client prior to intercourse and anchored around the cervix. The open ring covers the labia. The condom is removed and thrown away after intercourse. The advantages of a female condom is that it offers protection against pregnancy and STIs. Spermicide. It is designed to prevent fertilization by killing and inactivating the sperm as they ascend through the female genital tract. The types of spermicide include foam, jelly, cream, melting suppository, foaming tablet, and soluble film. It is important to educate the client to insert the spermicide from 0 to 30 minutes before coitus. Jellies, creams, and foams may protect for 8 hours, and that tablets and suppositories may be effective for only 1 hour. The advantages of spermicide is that it is widely available over the counter and generally costs less, and it includes no systemic absorption. Disadvantages include injury to the vaginal and cervical epithelium, urinary tract infection, and not for women at high risk of HIV infection. Diaphragm. A dome-shaped cup with a flexible rim made of silicone that fits snugly over the cervix and are available in a variety of sizes. Spermicidal cream or gel may be placed in the dome and around the rim to increase effectiveness. It is important to educate the client that it needs to be properly fitted by a provider, replaced every 2 years, and refit for 20% weight fluctuation. It needs to be inserted and removed properly. Spermicide must be applied with each act of coitus. Bladder must be emptied prior to insertion to decrease pressure on the urethra, and the diaphragm should be washed with mild soap and warm water after each use. Cervical cap. A silicone rubber cap that fits tightly around the base of the cervix, which creates a physical barrier against sperm. Cervical caps are available in 3 sizes. Spermicides also increase its effectiveness. It is important to educate the client to insert up to 6 hours before intercourse and leave in place at least 6 hours after intercourse, but for no more than 48 hours. Replace every 2 years and refit after any gynecological surgery, birth, or any major weight fluctuation. Advantages include an extended period of use and no additional application of spermicide needed. Disadvantages include a possible risk of acquiring toxic shock syndrome, risk of allergic reaction, and that it does not protect against STIs. Contraceptive sponge. A small round concave-shaped polyethylene sponge containing spermicide which fits over the cervix and acts as a physical and chemical barrier against sperm that enters the vagina. Client education includes a one-size-fits-all. It moistens with water prior to insertion, and it should be left in place for 6 hours after the last act of intercourse and provides protection for up to 24 hours. Advantages include that it can have repeated acts of intercourse and it is easy to insert. Disadvantages include that it does not protect against STIs. Hormonal birth control. Combined oral contraceptives. It is a hormonal contraceptive containing estrogen and progestin. It is important to educate the client that a prescription and follow-up appointments with the provider are required. It needs consistent and proper use required for effectiveness. Observe for adverse effects. And if a dose is missed, take one as soon as possible. If 2 or 3 are missed, follow manufacturer's instructions. The advantages include that it is highly effective if used as instructed and many non-contraceptive benefits. Progestin-only pills, or the mini pill, is an oral contraceptive containing only progestin. It is important to educate the client that the pill must be taken daily at the same time, a dose must not be missed, and another form of contraception should be used for the first month. Advantages include that it has less adverse effects than combined oral contraceptives and is considered safe for breastfeeding. Disadvantages include that it is less effective in suppressing ovulation than combined contraceptive pills, it has an increased occurrence of ovarian cysts, it does not protect against STIs, and has adverse effects. Emergency oral contraceptives, also known as the morning after pill or Plan B, is meant to prevent fertilization from happening. It is important to educate the client that the pill is to be taken within 72 hours of unprotected intercourse, and nausea can occur. Providers recommend that an over-the-counter antiemetic can be taken 1 hour before each dose. The client should take a pregnancy test if menstruation does not begin 21 days following the pill. Educate the patient about contraception and modification of risky sexual behaviors, and educate them that this is considered an emergency contraception. Advantages include that it is not taken regularly and anyone is allowed to purchase over the counter regardless of age and gender. Transdermal contraceptive patch is a patch containing progesterone and ethinyl estradiol delivered continuously through the skin. It is important to educate the client to apply to dry skin overlying subcutaneous tissue that is not on the breast. The patch must be replaced weekly and apply the patch the same day of the week, 3 weeks on and 1 week off. Advantages include that it keeps hormone blood levels consistent, it is not absorbed into the body by the liver, and there is no risk of forgetting a daily pill. Injectable progestin is an intramuscular subcutaneous injection of medroxyprogesterone given every 11 to 13 weeks. It is important to educate the client that injections should start within the first 5 days of the menstrual cycle every 11 to 13 weeks afterwards. Follow-up appointments should be kept, and adequate intake of vitamin D and calcium should be maintained. Advantages include only 4 injections per year, it being very effective, lactation is not impaired, absence and periods of decrease in bleeding are possible, and a long-term decrease in uterine cancer risk. Vaginal ring, a silicone ring that contains etenogestrel and ethinyl estradiol that are delivered at continuous levels vaginally. It is important to educate the client to insert the ring vaginally, perform ring replacement after 3 weeks, and replacement of new vaginal ring within 7 days, and if removed for greater than 4 hours, replace with a new ring. Advantages include that it does not have to be fitted, it decreases the risk of forgetting to take a pill, and vaginal route delivery increases bioavailability of hormones, enabling lower dose and reducing adverse effects. Implantable progestins are small, thin rods consisting of progestin that are implanted by a provider under the skin of the inner upper aspect of the arm. It prevents pregnancy by suppressing the ovulatory cycle and thickening cervical mucus. It is important to educate the client to avoid trauma to the area of implantation and wear condoms for protection against STIs. Advantages include that it is effective continuous contraception for 3 years. It can be inserted immediately after spontaneous or elective abortion, childbirth, or while breastfeeding, and is reversible. Intrauterine device, or an IUD, is a chemically active T-shaped device that is inserted through the cervix and placed in the uterus by a healthcare provider. It releases a chemical substance that damages sperm in transit to the uterine tubes and prevents fertilization. Implants and IUDs are the most effective contraceptive methods at preventing pregnancy because of their long-acting reversible contraceptive methods. Intrauterine device, IUD continued. It is important to educate the client that the device must be monitored monthly after menstruation to ensure presence of the small strain that hangs from the IUD. A consent form must be signed prior to insertion. A pregnancy test, pap smear, and cervical culture should be negative prior to insertion, and if pregnancy is suspected after IUD insertion, a sonogram can be needed to rule out ectopic pregnancy. Advantages include that the IUD can maintain effectiveness for 3 to 10 years. Insertion can be immediately after elective or spontaneous abortion, childbirth, and while breastfeeding. Contraception can be reversed with immediate return to fertility, and it does not interfere with spontaneity. Surgical methods. Transcervical sterilization includes the insertion of an implant in the lumen of each fallopian tube, as seen below. Transcervical sterilization. It is important to educate the client that they can return to normal activities within 1 day of the procedure. An examination must be completed after 3 months to ensure total blockage of the fallopian tubes. Advantages include a rapid return to normal activities of daily living. It is a quick procedure with no general anesthesia, 99.8% effective in the prevention of pregnancy, and it is a non-hormonal means of birth control. Disadvantages include that it does not prevent against STIs and STDs, it is non-reversible, it is not intended for use in postpartum patients, and its effectiveness takes effect approximately 3 months later. Advantages include an unaffected, also known as a bilateral tubal ligation, is a procedure that prevents the ovum from being fertilized by the sperm. Advantages include an unaffected sexual function, a permanent contraception, and the procedure can be performed after childbirth within 24 to 48 hours. Disadvantages include that it does not prevent the contraction of STIs or STDs, it is irreversible if the patient ever wishes to have children, and is a surgical procedure where general anesthesia is required. Also known as a vasectomy, is a procedure of ligation and severance of the vas deferens. It is important to educate the client that after the procedure, other forms of birth control will be needed for approximately 1 week to several months, or approximately 20 ejaculations, to ensure complete male infertility. Follow-up with physician for sperm count is important. Scrotal support is recommended to alleviate discomfort, and moderate activity is recommended for a couple of days following the procedure. Advantages include that the sexual function is not impaired, it is a permanent contraception, and the procedure is safe, short, simple, and can be done as an outpatient. Disadvantages include that it does not protect against STIs and STDs, it requires surgery, and can be reversed but not always successful. When one has a form of contraception, create a healing environment for the physical and spiritual self that respects human dignity. In Jean Watson's 8th Caritas process, it emphasizes on how everyone has a designated environment that they can heal themselves in. These environments include cleanliness, safety, traditional and alternative healing modalities, beauty, kindness, orderliness, privacy, and more. For healing environment and contraception, when one goes to seek contraception methods, they may not feel safe doing so. The healthcare personnel can create that healing environment for a patient or promote one in their own space. When one has a form of contraception, it may make them feel more safe and secure as it respects the outcome they would like, not wanting a pregnancy or STD. Contraception can respect and promote one's own dignity as they were the ones who made that choice, and it gives them the power on when they would like to become pregnant and when they would not like one by having a method of contraception and which one to use. Teaching and learning that addresses individual needs and comprehension styles. Learning is more than receiving information, facts, or data. Teaching is much more than presenting relevant content and urging the learner to wisely apply the information to whatever situation that he or she is in. Teaching. The nurse needs to determine how a woman will respond to an unplanned pregnancy to help guide her in making a decision about contraceptive use. Nurses should provide patients accurate information about failure rates of various family planning methods, and nurses have a special responsibility to inform patients about reproductive health and family planning. Learning. The content which is being presented as well as the readiness to receive are important factors. A meaningful and trusting relationship must be present to achieve a successful teaching and learning process. The teaching needs to match the person's learning style, the content needs to be sensitive to the learner's interests, and the nurse needs to understand the readiness of the learner or patient. References.